ever went to the dentist and found out that they were using a space set to clean your teeth? You'd be horrified, right? Well, luckily for those practitioners who do not use specialized dental instruments, dogs and cats cannot speak. Like our own dentists, dental prophylaxis in animals must be performed with specialized dental instruments to effectively do its job. Let's discuss some of them. General scaling of the teeth is done with ultrasonic scalers. These machines generate a vibration at a frequency of 25 kilohertz, converted into a horizontal vibration of this tip. This has the ability to scrape the crown surfaces of the tooth. Since continual friction causes heat on both the instrument and the tooth, a continual flow of pressurized water comes out of this hole right here, while this tip is in contact with the tooth. Manual dental scalers have a finer tip, and its use is more focused on removing plaque and calculus below the gingival margins. A dental curette has curved tips of varying angles, which is meant to manipulate the tooth within the gingiva during extractions or to scrape calculi deposition within the root of the tooth. For patients with severe calculi deposition, as you can see in this image on the right, tartar removing forceps are indicated for open close quotation mark cracking the tartar to efficiently remove it. You might see some practitioners replace this instrument with hemostatic forceps. I would not be surprised if their hemostatic forceps are now blunt and damaged. Calculi depositions as big as shown in this picture are recommended to be removed by the tartar removing forceps because your scalers just cannot do the trick. If you force to use your ultrasonic scalers on this tooth, your scaler would go blunt, the tip would easily be worn out, and you'll just be damaging your machine when a simple forceps can do the trick. Dental extractions are done with specialized dental extraction forceps. Now, you might see in practice that hemostatic forceps are used to remove teeth. Well, our motto in this country is basically if it gets the job done, then don't complain. But be careful with your instruments. Unless you bought your instruments for like 100 pesos a piece, then you would expect that the quality is quite low. Then sure, use it whatever way you want. But a lot of these instruments are devised to do their jobs because you would want to protect your instruments from the wear and tear, so to speak, with common instruments. I mean, imagine you're using a hemostatic forceps in the morning for dental extraction, and then you're going to use a hemostatic forceps later in the afternoon for a spay, and you just have one set. Even if you clean it or you submerge it with povidone iodine, you cannot automatically assume that it's really clean. Remember, dental prophylaxis is a dirty procedure. You're basically removing bacteria, thick coats of bacteria from the mouth of an animal. So might as well you could invest in specialized instruments for that kind of procedure. After scaling, polishing is done to the teeth. This makes use of a polishing machine with a disposable rubber tip. A prophy polishing paste is used for this step in the prophylaxis procedure. With all that, to identify how to use these instruments and what it does to the teeth, we will discuss the step-by-step procedure of the dental prophylaxis in the next video. See you there.